Hi, everyone. We'll give it just one more minute for everybody to join, and then I will get started. Thank you for joining HealthMan on Navigating MIPS Performance Year 2019. Okay, thank you very much for joining Navigating MIPS Performance Year 2019. We're going to get started right away. My name is Michael Lewis. I am a MIPS and macro specialist with years consulting in the industry, as well as being the director of sales here at HealthMan for the last year. So as you can see on your little pane for GoToMeeting, you'll see that you could ask questions. I will try to get to most of the questions at the end of the call. Otherwise, I will reach out to everyone after the call with not only a copy of the presentation and a video of the presentation, but I will answer your questions one-on-one if you ask them here. Also on this page, you'll be able to see that we have Navigating MIPS in 2019 handout that you can download to follow along or share with your teammates within your organization. So please ask as many questions as possible. That's why I am here today. For those that are on the webinar and have not purchased MIPS Pro as of yet, we are offering a discount code. HealthMan Webinar 19 is the code. If you enter that in, you will get $40 off of our Plus package, as well as smaller discounts on our other packages. Remember to enter that in at checkout. A little bit about HealthMan. We are dedicated to bridging the gap between QI activities around key healthcare system initiatives and revenue improvement, delivered through solutions of measuring, tracking, and improving financial, operational, and quality outcomes. Basically, we are not here just to gather your data and report it to CMS. We are here to help you, in the end, help your patients with better quality of care. Today, we're going to go through the 2019 MIPS Roadmap to Success. We're going to start off with taking steps to make sure you become a MIPS expert, or as I like to say, enough of an expert to pass. That's what we're looking for at this time of the year, as we are in mid-February and we only have about 30 or so days left to report. We're going to work with different ways to determine how you will report to CMS in 2019. And then we're going to take a look at how MIPS Pro is going to help you get there. So to start off, the new thing that we want to make sure that we cover right away is there has been an increase in the number of eligible clinician types in 2019. All of those on the right-hand side were brand new for 2019, and just for your knowledge, they are all still there in 2020 as well. So the population of those who need to report MIPS has increased pretty drastically over the last year. If you find yourself eligible as a new person in year 3, and you are one of those new types of providers that you see, there are some exemptions to some of the different categories of MIPS. Please reach out to us to see where you fit in. So there are exemptions to MIPS in 2019. Those who are newly enrolled in Medicare, that enrolled and are seeing patients for the first time in Medicare in 2019, do not need to report. Those that fall under the low volume threshold, and that is all of your providers that have less than $90,000 in Medicare Part B, or less than 200 patients and less than 200 covered professional services. Now there are ways, and I'll show you on the next screen, how to opt in if you meet any one of those three low volume threshold numbers. And for some people, it is well worth the idea to opt in for 2019, and even more worthwhile to opt in for 2020. Advanced APM participation, as we've seen, these numbers have changed drastically over the years. We are getting many phone calls right now from providers that have dropped out of an APM for 2019 and didn't know it until right now, and need to do something last minute to report. And we are here to help you with that. So starting in 2019, clinicians or groups may opt in to MIPS if they meet one or two of the following criteria. Why this is important and good is because we have providers that may fall below those 200 Medicare Part B patients or 200 covered professional services. However, they may be well above that $90,000 in charges, and with even a small 1% incentive, they can see a gain in what they are receiving come 2021 in their Medicare reimbursement. And if they do well, which in 2019 and 2020 is an option, they have the chance to make up to 4% in 2019, 4% plus, and higher in 2020. Another option that we have is reporting as a group, and why you would want to report as a group. Reporting as a group, the benefits are there's a potential for increased return on your investment. As you can see by the screen on the right-hand side, the difference between reporting just 2 eligible providers compared to the entire TIN, with just a small incentive, I put it at 1.88, you can see that the estimated return on investment is drastically higher by reporting everybody. And at this point of the year, if you've gathered the data for everybody, why not report everybody if they can all get part of that incentive? As well as it reduces the administrative burden, all clinicians in the team will receive the same base score. However, there is an option in the system where you can report as a group and as an individual, and not to confuse you, but what that would do is that would take providers that score above their group score and give them their their individual score, and it won't penalize those who perform less than the group score by giving them the group average. So you'll be able to maximize your return on all of those providers. The revenue at stake for 2019, as I showed earlier, it's around 4.69% for 2019. That's for your top performers, but the penalty is enormous. And I think a lot of people that may be on this call, and by some of the questions, is that avoiding the penalty is the most important thing at this time of year. And that penalty gets larger and larger every year. As you can see, it's 7% for 2019. And then for data that you're doing in 2020, it moves all the way up to 9%. Why this is important is because it's actually very easy to avoid the penalty if you're a small group under 15 providers, and you could avoid a lot of the penalty by just doing a little bit of work for those groups that are over 15 providers. It's not a time to throw your hands up and say, well, forget it, because 7% is a lot of money. (2019) transition year pacing options. I think most of us are sitting there in that second bucket, just trying to get to penalty avoidance. But you'll realize even shooting for 30 points by doing minimal work, you'll be able to get some incentive because you probably will score over 30 points as things are adjusted in the system. You're exempted from certain categories and so forth will allow you to get into that some incentive category. And for doing minimal work, maybe you do get a 0.5%, and it is worth every penny of it because the amount of work you're doing to avoid the penalty, you're going to be able to get an incentive. For those top performers, that is 75 to 100 points. Those providers are what are going to have the opportunity for gaining reimbursements increases of up to 4%, as I was sharing earlier. Performance category weights in 2019. We have quality that still takes a big portion of this. Promoting interoperability is still at 25%. Improvement activities, once again, is also still at 15%, how it has been for a number of years. And cost is now 15% in 2019. This is becoming more and more important as the years go on. You'll see this increase and take a chunk out of the quality side every year past 2020 into the future of this program. The first area we're going to concentrate on is quality reporting requirements for the basics. 6 measures need to be reported. At least one must be an outcome measure and or a high priority measure if an outcome is not available. You need to report data on at least 60% of all patients seen in 2019. That includes all payers, not just Medicare. That is very important for new providers that are here for 2019 with MIPS. As before, when they did PQRS, it was only Medicare. Now it is all payers. And practices larger than 15 providers cannot report via claims. Also important to share at this time of year is how do we just avoid the penalty? To avoid the penalty in 2019, if you are a group under 15 providers, you will need to report 6 measures for at least 1 patient each. By having the 1 patient each, you will get a minimum score of 3 points for each of those measures. And then you're going to also add, and I'm going to get into it in a little bit, the improvement activities that will get you another 15 points and get you across that 30-point threshold. Larger groups, if in 2019, if they only report 1 patient per measure, the maximum they can get is 1 point in 2019, and that is going away in 2020. So those people need to have been reporting quality data or promoting interoperability to have the opportunity to avoid the penalty for large groups. But for small groups, 6 measures, 1 patient each. It can be the same patient, or it could be 6 different patients, or any combination therewith. And you will take that from patients you saw in 2019 and enter that data into a system like MIPS Pro, and you will be able to avoid the penalty coming in 2021. So how can MIPS Pro help you? So if you have a file in your EMR, your practice management system, that covers all of your data and all of your coding that's in your system, whether it's your billing coding, your CPTs and ICD-10 codes, whether it's the answer codes to MIPS, your G codes, and so forth, you can upload a spreadsheet directly into our system. At this point of the year, that's what we're looking for, unless you're with one of our partner EMRs. If you need to report 2019 MIPS, we can take that data all the way up until March 15th in spreadsheet format and upload it into our system to get you your maximum score. As we state on this screen as well, though, we also do have multiple EHR integrations. We're able to take MIPS CQMs, ECQMs, as well as we have some QCDR measures, which are specialty measures made for some individual providers. And we do have the ability to upload custom spreadsheets, whether it's HL7, QRDA1s, or your billing files. However, we are getting close to the finish line in 2019, and that information is not as easily found by your EHRs or in your billing systems to get what we need to report. So I highly recommend reaching out to us as soon as possible if you're going that way. Otherwise, if you're uploading spreadsheets or you want to manually enter the information into our system, you could do that as well. Just taking a quick look on a couple screens of what it looks like using MIPS Pro. This first screen here shows you what our dashboard would look like with the deciles and the scores on the right-hand side, as well as giving you the opportunity to see what you're met and not met for each measure, your numerator and denominators for each measure. And we could dig down deeper into that information. We can take a look, as you can see on this next screen, of what it would look like if we were looking at more measures. You can track up to the total number of measures in our system, which is well over 200 for 2019 and 2020. And then you could also separate this into NPIs, which I believe I'll show on the next screen, where you can take a look at an individual provider's NPI and see what their score is compared to the rest of your group. So you can see who is performing better, who needs help, and so forth, where you need to dig into data and to get better scores. We're going to take all this information. As you can see, you're not going to report on 12 measures. You're going to report on 6 measures. We're going to take all of that information here and gather your actual points for 2019 reporting with your top 6 measures. You can report more, but we find that it is rare that it helps you. But some people, significantly, it does help, but significantly, that most people are just reporting their top 6 measures. On the next screen, you'll be able to take a look at what it looks like when you are checking out individual measures as well as individual patient visits, and where we're able to help you take a look at your gaps in care, where information may be missing. So you can see the yellow dots on the screen are where you're not met. However, some of the not met could just be because your data is incorrect, and we need to make a change in what you're uploading into the system. We also have our Catalyst program, which is going to help you improve your score. We give you ideas throughout the program by clicking on it. So the next screen is going to be the PI reporting basics. So PI for 2019 is a 90-day minimum reporting period. It's the use of your 2015 certified EHR technology. It's performance-based scoring this year, which is new, as well as the PI measures can be tracked and submitted through MIPS Pro. This area, you would have had to do the work back in 2019 and all you would do within our system is upload the information, the numerator and denominator, and attestation information for each one of these measures. There are some exemptions, and this is where a number of providers that are on the call today can gain a benefit by not having to report PI, and all of their 25% would move straight over to quality. Those who have automatic exemptions are PAs, nurse practitioners, as well as your non-patient facing clinicians, and all of the new providers that were added in 2019. There are some other ways that you are able to get exemptions, but those have expired as of now. On to improvement activities. Improvement activities in 2019, 90-day minimum reporting for it. There are more than 100 improvement activities available. For small groups, you will need to get 20 points, which would be two medium weighted measures or one high. For larger groups, you will need at least one high and two medium, or four medium or two high. You can use the points in any way. You can see 20 points for a high weighted and 10 for a medium. Any way to get to the number you need will get you the full 15 points in your score for improvement activities. This is a toss-up currently. It's easy information that you're able to achieve. Do not miss this in 2020. It's a good 15 points without having to collect a lot of data. The last category is the cost requirements. You're going to automatically calculate this from your administrative claims. The performance period is over the year. In 2019, there's 2 measures on Medicare Part A and B beneficiaries, as well as 8 episodic measures. We at HealthMan are working on a program that I think you'll be very excited about, that will be launching towards the end of the month of March, and look for more information as we get closer to that date. So how are we here to help you? I understand that this is the end of the year. We're getting close to the finish line. We need to come up with a plan to get everybody to that minimum threshold. We are here long days for the next month to make sure that our customers and those who are seeking information can reach out to us so that we can work with them to help avoid the penalties. That 7% in 2019 is easily avoidable, as I've stated. So we're here to help you. Please reach out to us. We're going to be able to give you real-time updated scores as soon as you upload your information, if that's how you would go. We are able to report on all the MIPS categories within our program. We have our experts here to review each of the submissions before you submit it so that you feel comfortable when you go to submit your data. We have 100% stateside support. Everybody is located here right outside of Philadelphia in Pennsylvania. They are here, they are MIPS experts, and they're able to help you figure out what you need to report, what might be missing in your data, and get you across the finish line as quickly as possible. And as you may guess, as the year gets closer to the end of March, mid to the end of March, they will become busier and harder to get a hold of. So reach out today so that you can guarantee yourself their full expertise. For 2020, we have also already started with our year-round reporting. And we also have the ability to check your dashboards. And moving forward for 2020, that minimum threshold that I mentioned moves up to 45 points. So there is no easy way out in 2020. You need to start collecting your quality data today to make sure that you hit the minimums. And as I also stated on a previous screen, we are here to help you integrate your data from a number of our partner EMRs. Every week, we are adding new EMR partners to our partnership program to make it easier for our providers to do well in these programs. Finally, for more information, feel free to ask questions at contact@healthmonics.com below. Our phone number on the sales side is 888-720-4100. Make sure you hit extension 3 for the sales team. If you're already a customer, you can hit extension 2 for our support team. To sign up, visit MIPSPro.com, and don't forget to use the HealthMan webinar discount code for 2019 reporting. Now, if everybody wants to hold for a minute, I'm going to take a look at the questions and see if I find anything that would be valuable for everybody. Otherwise, I will be emailing my answers out shortly to everybody here. All right, there are a few questions, and I'll try to start answering them. A number of them are very specific to your EMR. I'll get back to you one-on-one with that information afterwards, after consulting with our partnership manager here. However, one question is do you give instructions on how to upload? Absolutely. Everything we do is we have availability to give you instructions on how to do it, and our support team is here to help you as well. They're excellent with that, and they're excellent. They can walk you right through the process. The best thing to do would be to email either the contact number you see below or support@healthmonix.com, and they can set up an appointment time with you to help you upload that information. For a list of the EMRs that we're working with currently, if you go to our web page and in the click on pricing, and then on the bottom left-hand side, you'll see data integration. If you click on that, you'll see all of the EMRs that we have worked with in 2018 and 2019. However, we do also have a list under our partner section of our website that will show you who we are integrated with directly. Another question about being exempt. I think there are a number of providers that could be exempt, and looking at group scoring may or may not benefit you, and that is an individual case-by-case circumstance. So if you want, you can reach out to us here on the sales team. We may be able to give you some advice on whether to go with individual reporting, group reporting, or in some cases not reporting at all because your data isn't either there and you're already exempt from reporting. So please reach out to us and we'll help you with that. Waiting for a couple more questions to come in. This went very quick today. I apologize. I flew through it a little bit. But if you want to still ask questions, I'll still be here for a little bit more. Question just came in on, can you help us report if our EHR is not 2015 certified? Absolutely. The 2015 certification is for PI in most circumstances. Your quality data can be handwritten anywhere. The data needs to be collected, does not need to be in a 2015 certified system. So yes, we can help you report for quality reporting and improvement activities in 2019 and 2020 without a certified system. All right, everybody. If you have any more questions, feel free to reach out to us via our email, our phone number to the left of the screen. We look forward to helping you report in 2019 and beyond, and look for some exciting news from HealthMan and MIPS Pro moving forward. Have a great day.